Treating patients with COVID-19 is no easy task for healthcare workers. In fact, it's been a grueling 20 months, facing incredible stress and working long hours. ABC 27's Dave Vogan talks with a respiratory therapist at Capital Regional Medical Center who shares his experience breathing new life into patients.
There's a peaceful silence walking down these halls at Capital Regional Medical Center. But behind those doors, it's a different story.
What interests me most about being a respiratory therapist is the ability to help patients.
Antoine Brooks is the director of cardiopulmonary services at the medical center. He's also a respiratory therapist.
We really come in at a critical point in their life when they're struggling with breathing, and we're able to, in a sort of way, give them a breath of life and make sure that they can breathe easier.
They're the unsung heroes of the pandemic. 35 pictures of the respiratory therapists who work here hanging on the walls as a thank you for their sacrifice during Respiratory Care Week. A sacrifice that has a toll.
We stood in the gap for our patients and their families during the toughest point during COVID. We banded together as a group and made sure that we did what we could to save as many lives as possible.
Treating patients as if they were family.
We held the hands of patients as they were getting better. We celebrated with them as they got to leave and go back to their families. And we cried with their families when the unfortunate circumstance of them not making it.
A roller coaster of emotions that takes an entire team to navigate.
So leaning on each other is how we get through all of these difficult situations.
In Tallahassee, Dave Vogan, ABC 27.
Capital Regional Medical Center has been one of our local hospitals we've tracked during the peak of COVID cases. Now, the Florida Hospital Association says the summer Delta surge is over in Florida.